Apologies, but my guest is here. She practically had to run in here because, somehow traffic here and there, but she was able to make it. Well, today we're looking at postpartum depression. It is a condition that some women experience after giving birth. It involves feelings of sadness, anxiety, exhaustion that last longer than 2 weeks. Some persons put it at that number. Now, if left untreated, it can affect the well-being of both the mother and the baby. But first of all, the questions we should be asking is, how do we identify it? What treatment options are available for these women? Who can they talk to get help? That's also one. And how can we support them? Well, my guest is the founder, Master Coach, which is a coaching and mentoring hub. She is Dr. Aishat Adaviruku. You're welcome to the show.
Thank you very much.
We've had her before, but this is the first time we're meeting in person. The last time was via Zoom, and I'm glad we could meet physically today.
I'm glad to. Nice to finally meet you.
Extremely glad we could. Thank you so much for joining us.
Thank you.
All right, so we start with the, basic, which is, some persons talk about baby blues. Some persons talk about postpartum depression. Some say there's a similarity. Others say no, it's a wide difference. So what exactly is baby blues and how do we differentiate it from postpartum depression?
Okay, so when we talk about baby blues, it's a feeling of anxiety, sadness, tiredness that can last for a few days to a couple of weeks after giving birth.
Okay.
Now, the difference between baby blues and postpartum depression is that for postpartum depression, the negative feelings are more intense. You have a feeling of hopelessness, you have irritability, and on the part of the mother, she is unable to actually bond with her child. She looks at the child and there are no feelings. There are no positive emotions coming from her. And one of the core differences too is the duration. For baby blues, it can last for a few days to a couple of weeks. But when this feeling of hopelessness, irritability, anxiety, intense sadness is, it continues unabated for 2 straight weeks, then you know that you're facing a situation of postpartum depression. So you go in and see a health practitioner.
Okay, so how can the family members identify this? You talked about extreme sadness, irritability, but these days we just say, oh, God forbid, or we pray about it, or we speak to a pastor, we speak to an imam, and then there are prayer sessions. But how do we identify and say, no, this person has to see a professional?
Okay, so, as human beings, we are not only a body, we're a mind, we're a heart, and we're a soul. So the place of prayers is for the soul. The place of actually seeking help when it comes to mental health issues is to address the emotional and mental challenges that come with that.
Okay.
So you can do all together, but once you notice a mother that does not express joy at seeing their child, and the mother consistently feels tired, the mother is unable to actually discharge her responsibilities, she's drowsy all the time, she's sleepy, she lacks energy, and before then, if you notice that her personality has undergone a drastic change from how she used to be, then it is time to seek medical help. You can support with prayers, but please seek medical
help. Yes, I like how you said it. You can always support with prayers. Everything can go hand in hand, but whilst we go professionally. Now, what are the risk factors that increase the likelihood of developing postpartum depression? Are there any?
Yes,
okay.
There are.
Okay.
So, some of the risk factors are individuals that, during the period of pregnancy had a very difficult pregnancy. They are likely to face postpartum depression after the baby is born.
Okay.
So we have some individuals that go on bed rest, that bleed throughout pregnancy, when people carry multiple children, it's likely to also affect, the stamina with which they carry the baby. Some of these individuals that carry multiple children, they are put on bed rest. during the period of pregnancy because of some of the complications that accompany it. Then women that also suffer from depression before the pregnancy, they are also likely to suffer postpartum depression. Then women that face financial challenges. Pre-pregnancy, during pregnancy, and post-pregnancy, they are also likely to go through postpartum depression. So once all this, some of this or all of these are present, and then you also notice the symptoms of postpartum depression, then you should seek medical intervention.
All right, it's a Classic FM 94.3 Abuja. It's focused on how we're looking at postpartum depression, and we have a doctor right here in the studio. You can send messages via WhatsApp 0909 697 5943. Now let's talk about, you've spoken, how is it properly diagnosed in professional health service, and also after diagnosis, what happens next?
Okay, so we have standardized interview and also standardized screening methods used by medical practitioners to diagnose postpartum depression. So when an individual notices some of these symptoms that we have listed, then they go in to have themselves interviewed and tested. And then it's on a scale. So it could be mild, it could be medium, and it could be severe. So depending on, the diagnosis, the medical practitioner can now recommend a treatment option.
And then when the treatment begins for the woman who's going through postpartum depression. Now, if someone decides that, or probably like we've seen in some cases where there were no proper diagnosis, they didn't even go to the hospital, no professional help, what's likely to happen to that mother?
It can cause a worsening of her mental state. Sometimes we say somebody has entered town. The person has, lost their sense of reality. It's because it was not properly diagnosed. The symptoms were not properly caught on time, and treatment options explored. So it leads to a worsening of the mental state of the individual. And not only in this particular instance, not only will the woman be affected short, medium, and long term, but the baby that she's nurturing would also be affected short, medium, and long term.
Okay, now there was I'm going to take you through a story. It happened, I think, in the United States. We've seen two consecutive stories about how two mothers were tired of living with their toddlers. You might have seen that, right? There's a question associated with that, so just let me tell you that story. And you read it just for the sake of someone who's listening. And then these women said that they were tired, they had a lot, they were depressed, so they left their children unattended to for a week plus. Went on partying. Some of them went on a boat cruise. They had so much fun, and then came back about 7 or 8 days later. Opened the door, they realized that the child was dead. Now, when these matters were taken to court, the argument was that they were depressed. And some said it could be postpartum depression. Can postpartum depression lead to that? Even when the child is almost a year, is it still possible?
Yes, it is. Because untreated postpartum depression would keep worsening. In this particular instance, the women may have sought help, and those they sought help from, they weren't listening to their cries for help. But as a woman, right, if you're listening right now and you notice that you have challenges with nurturing your child and self-care, it's time to seek help. There are avenues available for you to seek help. Please seek help. Yes.
Okay, so you're saying that if not properly handled, not properly treated,
it can escalate.
Yes. So that's very, very scary. So it also means that postpartum depression can affect bonding between a mother and a child, and it could last for a very long time.
Yes.
Are there possibilities?
It can last into adulthood.
Into adulthood.
Yes, that's why sometimes you see challenges with parent. One of the most important lifestyle changes you can make for your mental and emotional health. So she had to learn how to meditate. She had to learn how to breathe deeply. She had to learn how to time her responses rather than reacting to events.
Okay.
Then we did rest. She had to get help so that she can sleep adequately, because sometimes sleep deprivation, of course, when you're nurturing a new baby, we even have what we call postpartum depression for men. Yes. In some cases, when men are deprived of sleep because of arrival of a new child, they can also go through a form of postpartum depression. But it's not
but we don't talk about
we
it.
don't talk about that.
And the men just feel like, oh, maybe it's because of the newborn baby.
Yes.
Wow.
Yes.
So men can also go through postpartum depression.
Course.
Oh my goodness. This is serious.
Yes.
So, does the man also need to go through the same techniques that you're putting through the woman through, rather?
Yes, of course.
Okay.
And in some cases, the woman may need antidepressants depending on if it's mild, medium, or severe. If it's severe, she definitely needs medication. Some of those medications may have possible side effects, but sometimes the medical practitioner will weigh it against, what the potential benefits.
Okay. Now, with all that we've discussed, what's I want to know your opinion on the place of probably, getting a help in the house that, would help the woman, would help the man, and now we have to add the men at this point, that would help the entire family, especially with the arrival of a newborn, because it can be chaotic sometimes. And especially, I don't want to say on the side, for everybody in the house, it's chaotic.
Yes.
So what's the place of getting a help that could help alleviate some of these, problems associated with taking care of a newborn?
It is highly recommended that you get help, get somebody matured, and if possible, train your help before you bring them into the house on childcare essentials, on personal hygiene and all of that. Because sometimes we even get a help that will worsen the situation. An untrained help, it's sometimes more dangerous than not having a help.
Okay.
So we have had cases where some babies were force-fed and it led to them giving up. Yeah. So we need to train our helps when we bring them in. It's something we need to pay attention to. And if possible, get more than one help so that they can rotate too. They're human beings, they can get tired. Right. So you can have maybe one on night duty, one on day duty, if you can afford it. If not, find ways of maximizing
stress.
Yes, maximizing and getting maximum rest as a mother, especially if you're already noticing that you're experiencing signs of postpartum depression.
And, ways they can reach out to someone. If no one is listening in the house, how can these women seek help? Especially when they're trying to demonize it. Like, oh, you need to go through a deliverance session, or you need to go, you need to see, a pastor and imam to pray for you. Now, how can these women say, okay, no, the way I'm feeling is different. I want to seek professional help?
So let them speak to their medical practitioners, invite their partners along, or all stakeholders in the family. And I also encourage medical personnel to pay attention when women come to you, screaming silently sometimes for help, because some of these women, they go through a lot. Sometimes the medical practitioners too, they are under tremendous pressure and they may miss some nuances. Like I had a client one time, when she was crying in the house for help and her husband was not listening, she had to enlist the support of the long-time medical doctor of the family to speak to her husband. And that was when her husband finally listened and got her the help she needed. So please, sometimes as medical practitioners, as mental health experts, we are the final bus stop for individuals screaming silently sometimes for help, and we should ensure that we pause and help.
Especially listen. That's, the part of listening. And also for caregivers at home, who, might notice these things and also would want to, seek help for maybe the madam who they think, oh, this thing is actually getting out of hand, or, the father is not acting very well. There's this, the bonding between the mother and the child is not going well. And they also want to say, okay, I think you should speak to a medical practitioner. Probably the person they are talking to, because of the state where they're in, they're not listening. Should they also reach out to a doctor or probably reach out to you personally? How can they go about it?
Yes, they may need to speak to, maybe if they know the decision makers in the family, right? They may need to speak to those decision makers. They can even, get the number of human rights and speak to them, or organizations that cater for women specifically. We have RAPA, we have GAFA, we have Human Rights Commission. So these are
the
some
Women's Secretariat.
Yes,
in Abuja.
And we have Women's Center. You can go into Women's Center and try to get help for whoever you think needs help. They are likely to be able to get the person help.
Okay. That's good. Thank you so much. It's been an interesting one talking to you about postpartum depression. We'll be speaking to the founder, Master Coach, which is a coaching and mentoring hub. She is Dr. Aishat Adaviruku. And, we're ending on the note of mental health, the importance of everyone, paying attention to their mental health and how exactly they can seek help if they notice something different, especially in the times that we're in. I just want you to speak to that, generally.
Okay, so when we talk about mental health, we're talking about our ability to feel and also to think well. And if we look at this, it plays into how we live our lives holistically. For WHO says that there is no health without mental health. We are how we think, feel, and behave. So if you notice any negative in how consistently, as human beings, we can feel negative emotions, we can feel positive emotions, but it is our responsibility to process our negative emotions without harming ourselves or harming others. When you notice that your negative emotions are leading you to harm yourself or to harm others, then it is time to seek professional help, because there is no health without mental health.
All right, there is no health,
especially in these very trying economic situations.
Oh yes.
Do you know the most important thing you need in these times is to be able to think well in spite of the challenges we're facing? Because whenever you face challenges, you need a clear head to be strategic about seeking solutions to those challenges. But even in the midst of the storm, you can practice stress management techniques so that you can clear your head to think of strategic, positive solutions to the challenges that we're facing right now. And the challenges are global. It's not only in Nigeria.
Yes,
Thank you so much.
Thank you so much, Dr. Aishat. Really do appreciate you for joining us today. A quick question just came through that said that if I notice that my wife is going through postpartum depression at, let's say, 9 months after, 9 months after delivery, is it still okay to seek help?
If you notice, if it's a day, 2 days, 9 months, 1 year, 2 years, if you've been married to somebody for 10 years, 20 years, and you notice an unusual pattern of behavior consistently for 2 weeks, please help them, support them, seek help, because in that particular moment, they may not be in the right frame of mind to even know that they need to seek help. So yes, please, at 9 months, if you notice that your wife, her personality has changed and now she's experiencing or going through some mental health challenges, please seek help for her.
All right, another question just came through as well. Is constant anger also a symptom of postpartum depression, especially after giving birth?
Not necessarily. Did you notice the anger challenges, before the person gave birth? Or is the person now finding it difficult to cope with their current situation, especially with parenting, and they're using anger to